Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. February is Age-Related Macular Degeneration, or AMD, Awareness Month, a disease that causes central vision loss. It's estimated about 1 in 10 Americans aged 50 and older are diagnosed with the early form of AMD. But there have been recent advancements in treatments for AMD that are making it easier for patients to manage this disease. So today, we're talking about how to prevent and slow down the progression of AMD and about the newer treatments to manage it with Dr. Ghassan Ghorayeb, an ophthalmologist and AMD specialist at the WVU Eye Institute. Welcome, Dr. Ghorayeb, to Live Healthy West Virginia.
It's a pleasure being here. Thank you for having me, Mary. And thank you for all you do with all the podcasts and all the wonderful information you help spread across the state.
Well, thank you. Thank you very much. I always like to start with the basics here. So, we talked a little bit about what age-related macular degeneration is. Can you tell us exactly what it is?
Sure. Think of the eye as a little bit of a camera. The front of the eye, or the lens, works just like the lens of a camera. It focuses the light beam onto the sensor of the camera, or the film, if you will. Mm-hmm. And that's the retina. That's the light-sensitive tissue of the eye that captures a signal from the lens, creates an electric signal, and sends it to the brain for the brain to interpret, where the magic, if you will, or the miracle of sight happens. That's the function of the retina. Now, the center part of that sensor, if you will, or the retina, is called the macula. That's where all your central vision comes from. That's where your sharp vision for face recognition and reading comes from. Macular degeneration, or age-related macular degeneration, is a disease, wear and tear, if you will, that over time damages that sensor, or the macula, hence the name macular degeneration. And people will lose, over time, the ability to recognize faces, increase difficulty reading, and seeing sharply in the center part of their vision.
Okay. Well, then there's more than one kind of AMD, right?
Absolutely.
Can you talk about that?
Absolutely. Think of macular degeneration as two categories, feel, or two types, or two buckets. The dry macular degeneration, you sometimes hear the terms non-exudative or dry. That's sort of think of it as like the slow rusting of that sensor, the slow progression of damage to that macula or retina. And that can slowly progress over time as we get older.
Okay.
Now, as opposed to a slow process or dry macular degeneration, you can have a sudden leak where blood vessels can actually grow, bleed, or fluid or blood. And that's a sudden vision loss called wet macular degeneration.
Oh, okay.
The treatment for both of these are drastically different. And the way we follow these diseases are different. They're not completely different, though. Macular degeneration always starts as dry, always.
Oh, okay.
And may not be recognized early as dry because may not have a lot of symptoms. And then as it advances, a subset of the population can have wet macular degeneration as a severe form of progression of the dry, if you will.
Okay. Well, you mentioned wear and tear earlier. Is that basically what causes AMD, or are there other causes?
Macular degeneration is principally age-related. That's the wear and tear part. However, there are certainly other reasons why we develop macular degeneration. Genetics, family history is a big one. Systemic diseases, cardiometabolic diseases, cardiovascular diseases such as diabetes, hypertension, cardiac disease are part of the equation. Modifiable factors are really important because those are the things we can actually work on and change.
So give me an example of a
the
modifiable
biggest one here
factor.
the biggest one here is smoking, of course, right?
Yes.
And that's a big part of the problem in West Virginia. And diet, healthy diets, and we can talk about that a little bit more if you will, but diet and smoking are two big ones, and UV protection as well.
And we do have a higher rate of AMD here in West Virginia, don't we?
Absolutely. So West Virginia, unfortunately, is 51st out of 51st, or the worst
Ugh.
state in terms of vision loss in the United States. In terms of vision loss, 1 in 30 individuals, adults in West Virginia will encounter vision loss, significant vision loss. That's almost 3 times as high as the other states.
National average.
Yeah, as the other states, for instance, in Maine and stuff like that. But in terms of smoking, if you think of modifiable risk factors, we're also 50 out of 51st, right? We're like the second worst smoking, with nearly 1 in 5 adults in West Virginia smoke. And you know that from a prior podcast on lung cancer, I believe.
Yep.
You guys mentioned that.
Yeah.
Whereas the national average, or median, if you will, in the U.S. is 1 in 10. We're over 1 in 5.
Yep. So that's probably the reason why we're, well, it depends on how you look at it. Number 1 or number 51 in all the bad categories. That's terrible. That's terrible.
We can do better, and we are working and improving ourselves.
So, does AMD ever lead to total blindness?
The short answer to anybody who may be worried about that's a very sensitive topic, of course, for any of our listeners who may be worried about them losing vision, their loved ones, their siblings, parents. The short answer is no. It does not lead to total darkness, if you will.
Okay.
So you never lose total vision. What the macular degeneration does can lead to legal blindness, where you would lose central vision, but often the periphery is left intact. Now, with central vision means you have a dark spot or dark shade or the wavy central vision, and you may lose ability to drive, which is a big deal in West Virginia. We all recognize that. Maybe lose ability to read, which is also very challenging for many, and difficulty of recognizing faces, which emotionally is very impactful for people. So that can happen. However, you never go blind in the sense of the word where it's dark, total darkness.
So that's still pretty bad.
It is pretty bad, but for some of us that encounter macular degeneration, there is a sense of comfort that we don't go in. It's not darkness we're talking about. And there are a lot of things we can do to, one, monitor this early on, but also slow it down as best as possible through various agents and treatments.
Well, are there any symptoms? Can you tell when, AMD is starting?
Yes, you can tell, but sometimes you can recognize this a little bit late.
Okay.
So for instance, you can imagine that with both eyes, binocular vision is critical. If one eye is doing well, where the other one's starting to have some problems, the good eye may cover or mask the symptoms of the bad eye. And therefore, sort of like, it is possible not to recognize it early enough because you're still relying on your more dominant eye. Clues could come, if you sort of cover one eye at a time, you may notice a difference between them. If you notice some difference clearly, you want to see some eye care provider to try to get a better sense of what's going on. Family history of macular degeneration should probably prompt you to come in, for instance, and get eye exams a little bit more regularly.
So it can run in families.
It does run in families, very commonly.
Yeah.
It does affect the demographics a little bit differently, Caucasian population a little bit more than other demographics, and genetics is a big part of this as well.
So what are some of the more prominent symptoms as it progresses? You just basically see a dark spot in the center of your vision or a blurry spot?
So it can start with central waviness, if you will. Lines, rather than being perfectly straight, can have a little bit of dents to them, and you can see that on sort of door when you're looking straight at door frames. It can have a little bit of a wave. It can progress to have central graying and then darker spots for later on, and then that can expand and become a little bit larger over time. If it's the wet macular degeneration we talked about, is more of a sudden leak, if you will, that can come really quick. Whereas with dry macular degeneration can be slow and progressive, and can be slowed down through various treatment as well. And
wet always starts at dry.
Mm-hmm.
Okay. So how do you go about diagnosing AMD?
AMD is diagnosed through vision. symptomatic symptoms first, of course, from us. Then we as eye care providers will often not only check your vision, dilate your exam to look at the retina and make sure get an understanding of what's going on, but also get various tests. The most basic test we get now is something called an optical coherence tomographer. Optical coherence tomographer, OCT
Okay.
in short, 3 letters OCT.
Okay.
And that is in essence ultrasound CT of the eye, where you get a cross-sectional view of the retina or the light-sensitive tissue of the eye. It's not really an ultrasound; it's more of a light wave rather than ultrasound wave. But essentially, it gives you a cross-sectional in vivo or live view of the retina. And what we typically are looking for would be sort of waste product accumulation under the retina. Those are called drusen, D-R-U-S-E-N. Drusen are basically waste product that we typically eliminate through the normal visual cycle, where we see, when we see now, we create waste product and those are eliminated. With age-related macular degeneration, we start to accumulate those. And as they accumulate, they start to cause the problem for us.
Okay.
Waviness, and then damage to the light cells of the eye.
So floaters have nothing to do with this, right?
Floaters do not typically are necessarily linked to that. A sudden onset of floaters, now that you mentioned, Mary, and sudden onset of floaters, sudden onset of flashes of light make us more worried about potentially retinal detachments, which should not be ignored. But that's not typically associated with macular degeneration.
AMD. That's a different podcast.
Right.
So who's most at risk for getting AMD?
So age-related macular degeneration, as the name implies, is most of us over the age of 60. The prevalence of AMD increases exponentially as we get older. Caucasian population predominantly.
Mm-hmm. Family
history. So any of us who may have loved ones or parents or siblings with macular degeneration are high risk. Those of us who smoke are certainly higher risk. Poor diet, and by diet we mean basically not eating enough green leafy vegetables, fruits, nuts, Mediterranean style diet, if you will, omega-3 fatty acids.
That's good for everything.
It is good for everything.
It is.
Yeah, absolutely. I'm sure it's on every podcast it comes
in. Yeah.
And then patients with cardiometabolic diseases, diabetes, hypertension, hyperlipidemia.
Yeah. So it's time to quit smoking and getting a better diet. That's for sure. So I imagine that's the best ways to prevent AMD.
Absolutely, and to sort of seek eye care early on. The recommendation for when to get an eye exam vary across our sort of age groups.
Mm-hmm.
But it's relatively common for most of us to get at least a baseline diet exam at age 50 or plus. And then if we have diabetes or any other systemic disease, it's probably a good idea to get it checked every year. And if you have a family history of macular degeneration, you certainly want to be looked at more frequently. And if you do have macular degeneration, you're often going to be seen every few months, and then even more often by a retina specialist if needed.
But if we don't have any symptoms or anything now, is once a year enough?
Yes, typically once a year is a good
if you're old like
recommendation.
Me.
Like myself, not like you, Mary.
Okay. So I imagine early detection is important. So are there any other ways to, help with early detection besides, regular eye exams? What else should we be doing?
I think recognition of symptoms is part of it, right? Recognizing that central blurriness, any sort of vision loss, vision deterioration is not normal, and sort of not ignoring it, seeking help is going to be important. Understanding that most of us with cardiac disease and diabetes and hypertension should seek more often care. And certainly the idea of that, as I mentioned earlier, that if you have a strong family history of macular degeneration, you really need to be more careful.
Yeah. Okay, so once you're diagnosed with AMD, is there a way to treat or even like reverse what you've lost?
Reverse is unfortunately not currently possible. Treat, absolutely.
Okay.
Um,
So how do we treat?
we break down the treatment into wet and dry, as we mentioned
Okay.
earlier. So the wet macular degeneration, again, is the idea that you have a sudden leakage of fluid, whether it be blood or serosanguinous fluid, that causes sudden vision loss or distortion.
Okay.
That is treated through intravitreal injections. Those are injections in the eye, done on a monthly or bi-monthly basis. It sounds terrifying, surprisingly not painful, surprisingly very, very tolerable, and saves sights, saves quality of life.
I would do that to save my sight.
Yeah, and it's surprisingly less traumatic than one may imagine it to be. We numb the eye really, really well and do it. We use agents called anti-VEGF or anti-vascular endothelial growth factor that can stabilize the vision and in many cases improve the vision. If you catch it early enough, to your point, Mary, about early detection, absolutely critical to try to restore vision in many of those wet cases.
Okay.
The dry macular degeneration is different in the sense that this is a slow progressing rusting, if you will, of the retina. And there's no way to stop that. This is age related at this stage.
Yeah.
Had we had this podcast just 2.5, 3 years ago, the answer would have been we have no treatment for the dry macular degeneration. As it progresses, the rusting, if you will, or damage can coalesce into something we call geographic atrophy. Atrophy for damage and geographic because of the coalescence. And the central dark spot that patients experience will continue to increase until this whole central vision is gone. But now we have anti-complement injections. Those are injections that slow down a very low-grade inflammation that we think is a cause of this macular degeneration, like a smoldering inflammation that is probably oxidative or related to the oxygen stress, hence the diet of eating antioxidant-rich diet. So that is now treated with injection that do not stop the disease. However, these anti-complement injections slow down the disease and can prolong useful vision for many patients.
How much could it slow that down?
The current treatment we have slows it down at best by about 30%, 20 to 30%. It's not great, but it's good. And this is, again, what we have now versus 3 years ago, we had nothing.
Yeah.
And so
imagine what we have in 3 more years.
Right. So the question we often get, Mary, is there a cure? And the unfortunate answer is...
That was my next question.
Yeah, there is no current cure. But could there be a cure? Absolutely. I think it's not something that's going to happen within the next year or two. But is this something possible? There's certainly a possibility. And as we continue to improve the delivery mode of these agents, delivery mode is meaning the medicine that we inject can last a month or two. Now they can last 3 to 4 months. And then we have some medicine that can last even longer that we do it. And there's some, a lot of clinical trials going on, most of them being held at West Virginia University Eye Institute, where we're always looking at the forefront of medicine as to what else we can do to help, from gene therapy to future stem cell therapy as a hope for better outcomes.
So we're getting closer to a cure.
We are getting closer. We're not there yet. There's not within the immediate foreseeable future.
Right.
But I think
hope.
imagining a cure is not unreasonable at this stage.
Excellent. That's always good to hear. So I already asked you about the cure. So I want to talk a little bit about the WVU Eye Institute and what a team we have there. It's a deep bench, and we're growing. We're building this great building.
Very proud.
There's a lot of demand for. Can you talk a little bit about that? The level of expertise of the whole team at the WVU Eye Institute.
Absolutely. Yeah, I'm very, very proud to be of an amazing and a wonderful team of eye care providers at WVU Eye Institute. I joined WVU Eye Institute about 13 years ago, and the transformation that's happened over the last 13 years has just been remarkable. The leadership, of course, have a lot to do with it, from our chair, Dr. Tom Smallgar, to the leaders of WVU medicine, from Albert Wright and others, has been just instrumental in trying to get top-notch providers, really absolute experts in every subspecialty of ophthalmology that we can. We have state-of-the-art diagnostic machineries. We have state-of-the-art treatment options, and we're always at the frontier of medicine. But that's usually not enough, of course, as you can imagine. It's more the human part that comes in. we all understand that vision loss affects lives, affects families, not only the person affected, but their loved one next to them, who also have to sort of interrupt their own lives to take care of that person. And we have an entire team that's sort of like always trying to look at not just the eyesight, but the person behind it and the families that are involved in that as well. So very, very proud to be part of one of the most wonderful teams we can hope to work with.
So people don't have to leave the state to get excellent eye care.
Absolutely, yeah. We take care of most complex eye care diseases, and new building that we are currently raising is just going to help us bring in even more experts and more options for the state. Very, very proud of what's going on. I think it's going to be a flagship institute that's going to have many centers of excellence, and the one that I'm very proud about that we certainly hope to build further and further is going to be the Center of Excellence for Macular Degeneration.
Oh, wow. Okay. And more parking.
Parking will be a big plus. That's probably the thing that gets most people excited about.
Yeah.
It is a big deal.
But I mean, this is really exciting. When is this building supposed to be finished and open for business? I think
we expect it to be finished by mid-27, July 27.
That's not that far.
Not that far. I believe that realistically operations will probably start about 4 to 6 months later by the time we sort of like finish the transition. So I think expecting it end of 2027 would be a very reasonable goal, and hopefully we'll beat it.
Yeah. I bet we will.
They're doing an amazing job working. I mean,
it's
remarkable.
Right across the street. I can't get over
even
how...
with this weather and this cold. I mean, seeing them work. Really, I shouldn't complain about walking from my parking spot to the institute. It's amazing. That 3-minute walk.
Yeah. It's going up really fast. Yeah. Well, I always like to ask before we wrap things up is, what's the most important thing you want our viewers or listeners to know about age-related macular degeneration?
I would probably say that there's hope with age-related macular degeneration. What I often see and hear is fear, anxiety that comes in with the thought of a vision loss. And to those who are experiencing it and those who may be afraid of it, I would say there's hope. We're here at the Eye Institute for you, for your families. We are at the forefront of medicine in terms of eye delivery. But probably the most critical part is, as you mentioned, Mary, early recognition. With any of the risk factors you mentioned earlier, please seek eye care, get a dilated eye exam, and see a retina specialist should there be any concern of AMD. Early detection is critical to improve outcomes.
All right. Well, thank you so much for sharing this information. I mean, it's exciting, how much progress has been made just in the last few years. We got hope, right?
Absolutely. Thank you, Mary, for having me.
Thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on AMD and other eye diseases, visit wvumedicine.org/eye. To find the latest episode of Live Healthy West Virginia, visit our YouTube channel at youtube.com/WVUmedicine and click on the Live Healthy West Virginia playlist, or search WVU Medicine on Spotify to find this podcast and all WVU Medicine podcasts. I'm Mary Ravazio Menard, and on behalf of Dr. Ghorayeb and everyone at WVU Medicine, thanks for joining us.